Nationally and in our state, mental health conditions are the leading cause of maternal mortality, and that's by suicide and drug overdose. There has been a siloing of mental health and psychiatry as if it's separate. Every single person has a mental health, they have a psychology. We need to be aware of that, and we need to build the skills that we need to address that. There's this long-standing myth that motherhood is this most wonderful, magical time of women's lives, and that is really not true. Women don't feel comfortable reaching out and asking for help because they've been told, I'm supposed to be so happy during this time. There are layers of barriers that I feel, particularly with minority populations. There might be cultural barriers around mental health where it's not something that's talked about. There are societal barriers. If you're in a rural area, your options for care are limited.
We're doubling down on all things rural across South Carolina. 30% of South Carolinians live in rural areas. So if we're not thinking about that 30%, then who is?
There are some really great things that are working. One is provider facing, so our providers are already at full capacity doing everything that they can do, and they need additional supports around them to be able to address all the other components of health in our patients, including mental health. And then on the other end, we need to have patient-facing information where women understand that these conditions are really common. We find people are almost twice as likely to endorse those conditions if they're asked by text and phone versus in person. And then we need to provide really accessible treatment, so people should be able to pick up the phone and talk to somebody who's knowledgeable and can guide them in the right direction. Where that has led us at this point is a statewide perinatal psychiatry access program. So every pregnant postpartum individual in the state can pick up the phone, get access to care. Every provider that needs support and training can pick up the phone and get that training and support.
At MUSC, we pride ourselves in being innovative. We want to do all of these things, and you need the right partner to help. As James B. Duke knew 100 years ago, that needed to be supported. That needs to continue to be supported, but probably in a little bit different way than in the past. Communities are asking for help, and they're putting together partnerships, and they're putting together ideas, and I think that's the kind of person he was. And
I really hope that people will start to recognize the amount of support that is actually needed for this population, and we can surround women and families with that throughout pregnancy and the postpartum year.
Well, here we are wishing the Duke Endowment a happy birthday in their 100th year. This is MUSC's 200th birthday, and it's great to have two institutions, both dedicated to the community, celebrating a birthday at the same time. Two institutions that have worked together very well, and hopefully we do that for another 100 years.